In the last class, we have completed the programming for ADLB, and I told you ADLB and ADVS is both are going to be the same. Only the parameters are going to get changed. In ADVS, we are going to have parameters like height, weight, BMI, temperature, systolic, diastolic, pulse rate, respiration, body surface area, or something like that. Apart from that, everything is going to be the same. So if you do the ADLB, automatically you are going to do ADVS. Apart from that, ADSL and BDS. What is the full form of BDS, by the way, anybody?
Basic data.
Basic data structure. What is the structure of BDS? One or more records per subject, per analysis parameter, per analysis time point, right? Now, apart from that ADSL and BDS, now we have a third class, third kind of structure, which is called occurrence datasets. Previously, this occurrence is also used to be part of that BDS. But later, they have decided if you want to keep any data set in the BDS, that in the data set we should have a param type, eval, base, change. But in reality, some data you do not require param. All you need to have only the counts. How many times it occurred? I want to count how many times it occurred. If you want to count only how many times it occurred, then you do not require the param variable. You do not require the eval variable, and you do not require the base or change variable. Later, since you do not require that kind of information, so what they have done, they have divided whatever that occurrences that we have, they divided that into separate class, and they kept into a new class. They separated it as a new class called occurrence data. Okay, occurrence data structure. Generally, findings. Okay, generally findings datasets of SGDM supports PDF structure. Okay, findings supports BDS. Then interventions and events supports OCCDS, occurrence data structures. Again, not all the interventions supports OCCDS. Again, in the interventions, we are going to have a domain called EX and EC. These two supports BDS structure again. So generally, most of the findings domains supports BDS structure, and most of the interventions and events supports OCCD. But again, this is not a hard rule. Sometimes even the exposure as collected is part of the interventions. It supports BDS structure. Okay, and at the same time, in the BDS, and I'm telling you what is this OCCDS, how many times it occurred. Say, for example, how many times a subject got an adverse event, how many times he has got a headache, how many times he has got nausea, what the percentage. So if I ask you occurrences, how many times a subject has taken concomitant medication, how many times in the past he has got that problem, medical history. So concomitant medication, medical history, adverse events, all these supports, OCCDS structure, occurrence data set structure. So they kept separately OCCDS now a new classification, and what comes generally most of the times, what comes under OCCDS, and the most important OCCDS data set that we have is ADAE. Next important ADCM, then we have an ADMH, and we have an ADPR procedures. Okay, ADCE, clinical events, not so important. And again, ADSU supports again substance use also supports OCCDS. The most important thing, 50% of the time when you have an ADaM's interview, 50% questions you will get from ADAE. So in today's class, I will explain ADAE dataset. We'll see what are the variables that we have according to ADaMIC guidelines. Tomorrow's class, we'll see the programming code for ADAE. Clear, everybody? Now, before moving into the ADAE, can you please explain what is AE? How we can define AE? Anybody?
Adverse event,
Adverse events.
Untoward medical occurrence. Honor.
medical.
Untoward?
Any untoward reaction which may or may not be related to the study drug administered.
Adverse event, nothing but any untoward medical occurrence in a subject or a patient, who has been administered with, a pharmaceutical drug which may not necessarily have to have casual relationship with study drug. And this is the definition for adverse event according to ICH guidelines. Any untoward medical occurrence in a subject or a patient who has been administered with a pharmaceutical drug, which may not necessarily have to have a casual relationship with a study treatment or a study drug, is called as an adverse event. So, for example, this is a clinical study. Okay. In this clinical study, I took the informed consent on 10th of January. Then I started the screening. And then after the randomization, I started the treatment on 20th of January. And I had given the treatment on different visits. And I stopped the treatment on 10th of April. And after that, 20th of April was the last follow-up date. And after that, there will be no further contact between subject and to the sponsor. This is my study plan. Now, a subject called 101 involved in this clinical trial. Okay, he is a healthy person. During the clinical trial, obviously during the clinical trial, what he will do? He will take the treatment. What do you mean by treatment? He will take maybe study drug, or maybe standard drug, or maybe some placebo, a dummy drug. Whatever the treatment, whatever the drug he is taking, during the clinical trial, if he face any untoward medical occurrence, that we need to consider as an adverse event. Say, for example, this 101, during the clinical trial, on 22nd of January, he started feeling like, nausea. He's having some nausea symptoms. Why he got this nausea? We don't know. Maybe because of food he has taken outside, maybe because of the food infection. Maybe he was like, doing some fasting from the last 4 days or 5 days, maybe because of that one, maybe because of he is involved in the treatment, maybe because of the treatment, because of any reason, whether the reason related to study treatment or not, if he is feeling any discomfort, any untoward medical occurrence, that we need to consider as an adverse event. Later, we will postmortem that one, whether this adverse event is because of the study treatment, is it treatment related or not. We'll do that one later. First of all, we should consider as an adverse event. Because of the winter, he was exposed to the cold, he got the, fever. Not because of the treatment, because of some other reason, but still we need to consider as an adverse event. Understand this one? So, any untoward medical occurrence in a subject or a patient, obviously in a clinical trial we call it as a subject, who has been administered with a pharmaceutical drug. So, since he is involved in the clinical trial during the treatment, of course I'm going to give the treatment. I'm going to give some kind of drug, which may not necessarily have that untoward medical occurrence, not related or may be related because of the treatment, but still we need to consider as an adverse event. Understand this one? This is a definition is according to ICH guidelines. Understand this one? Now, not so important as ADaM, but when it comes with the ADaMs, we further divide adverse event. Again, I will tell you one important thing. If any subject has got any problem before the informed consent obtained, before the screening, okay? So, for example, I took the informed consent on 10th of January. But before the 10th of January, say for example, on 2nd of January, he has got some fever, dengue fever. You've been hospitalized for a couple of days. Now, you know what you call this as a? Since it occurred before the informed consent, before the screening, we should consider as a medical history. I'm not bothered about that one. That is before my treatment, before my study. So we should consider as a medical history. If you have any untoward occurrence after the informed consent, after the screening, now this is called adverse event. Okay? If you have anything occurred after the informed consent, that means once the treatment screening has been started, before the follow-up, if you have anything occurred, that we need to consider as an adverse event up to this point. Again, now in adverse events, we divide again adverse event into two types. If anything occurred during the treatment, if anything occurred during the treatment, and that we call it as a treatment emergent adverse event. So again, adverse event two types. One is a normal adverse event. The second one is a treatment emergent adverse event, which is called TEAE. Clear, everybody? What is TEAE? How we can define? Now, if you have an ADaM interview, without TEAE, you will not have interview at all. That much important TEAE. Tell me what is TEAE? If
Treatment emergent adverse
which
event.
occurred after the treatment getting started or before the last dose of the treatment, if you have any adverse event which occurred during the treatment, that is called treatment emergent adverse event. Then how we can define now? If any adverse event that occurred on or after the treatment started or before the treatment last dose has taken, if you have anything in between, that is called treatment emergent. What you call it as a treatment emergent adverse event. Now, what is the SAS algorithmic code that you can write now? Can you tell me the SAS in the SAS language how we can say an adverse event is a treatment adverse event or not? Now, if AE STDTC greater than or equal to treatment start date and AE STDTC less than or equal to treatment end date, then it is called treatment emergent adverse event. Greater than or equal to treatment start date and ఏ డేట్ అవుతుందండి ఈ ఎగ్జాంపుల్లో? If I say if AE STDTC greater than or equal to treatment start date or 20th or after the 20th of January. If I say AE STDISC less than or equal to treatment ended, that means before
Before 10th April.
10th of April. Now, if you have any adverse event started in between these 2 days, then it is called treatment emergent adverse event. Understand this one? Now we have one more definition for this one. Now I'll take a subject called 101. Okay. Now 101 having a headache from 18th of January. When did he started this adverse event? AE term is headache and AE STDISC is on 18th. Is it before or after my treatment or after starting of my treatment?
Before
Before.
the treatment.
You know, but before the treatment, the severity was mild. The severity was mild. But once the treatment has been started, the same adverse event, which is headache, the severity has been changed from mild to severe. Now, this is also called treatment emergent adverse event. Then how we can define this one? You may have adverse event before the treatment. That means that the adverse event may be pre-existing. But during the treatment, relatively, if the severity has been increased, the severity has been changed from mild to moderate or mild to severe or moderate to severe, still that also should be considered as a treatment emergent adverse event. Now, on a whole, how we can define treatment emergent event? A treatment emergent adverse event may not be pre-existing. If during the treatment, if it is appeared, then we should call it as a treatment emergent adverse event, or it may be pre-existing. That means pre-treatment, it is existing pre-treatment, but relatively, if the severity has become worsened during the treatment, then also that is also should be considered as a treatment emergent adverse event. Yes, this person is having a headache from 18th January before the treatment getting started, but that time the severity was mild. But during the treatment, the same adverse event has become worsened. That means the severity has become worsened. So mild to it changed to maybe moderate or severe, or maybe from moderate to severe. That also we should consider as a treatment emergent adverse event. Very, 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 very important interview question. First, they will ask you the definition. If you say on definition, then they will ask you, tell me the algorithm or condition that what you will write for treatment emergent adverse event. Clear, everybody? Now, what is the structure of ADAE data set? We don't require much changes from SGDM. If I change from SGDM, what is going to happen now? The hierarchy that what I applied in SGDM MEDRA dictionary. Remember what was the dictionary variable that we have in AE, MEDRA dictionary hierarchy variables? Now, if I change the structure now in ADaMS, it is going to get upset, the MEDRA dictionary hierarchy. So I do not want to disturb that one. That's why whatever the structure that we have in SGDM, we are going to maintain the same structure in ADaMS also. What was the structure of AE dataset in SGDM? Anybody? One record per adverse event per subject. Now, what is the structure of an ADAE structure in ADaMS? Here also, one record per subject as collected in SDTM AE domain. That means literally the structure of ADAE is nothing but AE structure, because we do not require changes here. Already we have a hierarchy, we have all the variables, so we are going to create some new variables. That's it. Apart from that, everything is going to be the same. Understand this one? Now. Analysis data model, data model structure for adverse events. The first one that we have in Definition for AE, as I said, any untoward medical occurrence in a patient or a clinical investigation subject administered a pharmaceutical product or a drug which does not necessarily have to have a causal relationship with the study treatment. And why it is important, adverse event? Adverse event is so important to understand the safety of the drug. The safety evaluation of the drug we'll start doing from AE only. By seeing that adverse events data set, we can say whether the drug is safe or not. If you have more and more adverse events, the drug is not safe. So the safety evaluation of a clinical trial data includes analysis of adverse events. Very, very important. Then, what are the important things we should consider when you're creating, ADAE data set? The first thing is the level of severity. Do you know where we can find the level of severity levels in SDDM? In which variable you can find that one? A variable called AE severe. So AE severe is a very, very important variable to create ADAE. So what values you can find in AE severe? Mild, moderate, and severe. And the next one is whether the adverse event is considered treatment related or not. How do you know whether the adverse event treatment related or not? We are going to have a variable called AE relation. In the AE relation, if you have an yes, that means this adverse event related to study treatment. If you have no, that means this adverse event is not related to study treatment. And the third one is whether the adverse event is considered serious or not. Where we can find this information? We have a variable called AE serious. AE serious is a yes or no type of question. If adverse event is serious, we are going to have an Y. Otherwise, we are going to have that variable is also very, very important. And then, is it that adverse event is in a treatment emergent or is in a pre-treatment or post-treatment? We should understand if it is in treatment emergent or not. So treatment emergent is an event that emerges during the treatment having been opposite pre-treatment or worsen related to the pre-treatment. Pre-treatment to start. That is also called as a treatment emergent adverse event. Apart from this AE severity, AE serious, AE relation, whether it's a treatment emergent adverse event or not, we are going to have other attributes like what is the action taken, what is the other action taken. So that is also important. These are the important attributes of AE dataset. Then the most important thing for adverse events or clinical events or medical history is coding. Because we always collect that adverse event as a verbatim, a short name, a local, verbatim name. But when we have a verbatim name, we need to create a standardized dictionary derived terminology. So we used to have different types of dictionaries, but everybody now CDISC officially recognized Medra dictionary. We are using only Medra dictionary. So these verbatim, whatever the verbatim names, AE term or MH term or CE term we collected, we need to process through a coding dictionary so that similar verbatim names are going to be get grouped together by classifying each verbatim term into hierarchy of medical granularity. Remember what are the variables that we have in Medra? Low level term, preferred term,
High level
term,
group.
high level group term, system organ class, and body system organ class. Okay. In the interview, they record ask you, do you know any other dictionaries apart from Medra? We have other dictionaries like WHO ART, World Health Organization Adverse Reaction Terminology, and we have a dictionary called COSTAT, coding symbols for thesaurus of adverse reaction terms, and we have one more dictionary called ICD. What is ICD? International Classification of Disease. And of course, we have officially recognized dictionary, which is called MEDRA, Medical Dictionary for Regulatory Activities. Then they will ask you, what is the current version that you are using? And you can say the current version that you are using is 25.1. Understand this one? Next one. So these are the hierarchy terminology that we have according to MEDRA dictionary. low level term, preferred term, high level group term, system organ class or body system organ class. Now we'll say the structure of ADAE. One record pair, subject pair, each AE recorded as in SGDM AE domain. So that means the structure of ADAE is equal to SGDM AE structure. Then what are the values you should have in ADAE? First value is study ID, use subject ID, site ID, and AE sequence. You already know about these variables. First, you will try to get from ADSL. Otherwise, you will get it from AE dataset of STDM. And next, we should have AE term. Do you know from where we can get the AE term? What is AE term? It is a topic variable of SGDM AE domain. And then AE decode, which is nothing but a preferred term. Then AE body system. We also get this one from AE dataset of STDM. AE body system organ class code, low level term code, preferred term code. Already we have preferred term as a decode, so we are going to get the preferred term code now. And the next we are going to have high level term code, high level group term code, system organ class code, body system and body system organ class code. Then we are going to have timing variables. Can you see what we have? AE STDTC. What is AE STDTC, by the way? Adverse event start date and time in character data type. Now, from that, I'm going to create a numerical date, adverse event start date numerical. So we call it as an analysis start date, analysis start date and time numerical, analysis start date imputation flag, analysis start time imputation flag, analysis end date and time character data type from SGDM. Again, we are going to analysis end date numerical, end date and time numerical, end date imputation flag, time imputation flag, and whatever that AE STDY that we have, we are going to get as an analysis study date. Then we have AE STDY. This is from AE dataset. AE ENDY analysis and study date of analysis end date, and this is AE ENDY. Analysis duration numerical. We have AE duration. That is going to be AE duration numerical. And what are the units? Days or months or weeks, whatever that we have, we are going to have. Then AE duration from AE domain, analysis period C, and then we are going to have analysis phase. Okay, and next, then we are going to have treatment emergent adverse event flag, whether adverse event is treatment emergent or not. Remember, I told you an algorithm. If adverse event started greater than or equal to treatment started, and adverse event started less than or equal to treatment ended, then TAE-MFL is equal to Y. And what is the treatment emergent adverse event? When we have a flag Y, whatever the term that we have, that is going to be treatment emergent adverse event. Then ANL ZZFL, which observation you take for analysis purpose? For that observation, 01FL is equal to Y. Either adverse event is pre-treatment flag. How do you know whether the adverse event is pre-treatment or treatment? ఇది ఎలా చెప్తామండి pre-treatment అవునా కాదని?
Treatment start date.
Very good. If adverse event started less than, treatment start date, then it is a pre-treatment flag, isn't it?
Yes, sir.
Then how we can say FUPFL, follow-up flag?
After treatment, like end of the treatment.
If adverse event started greater than treatment ended,
then it is FUPFL.
That is an FUPFL is equal to Y. That means that adverse event occurred during the follow-up.
Yes.
Understand the logic, everybody? Now, AOCCFL. What is AOCCFL? First occurrence of any AE flag. You know, a subject has got 10 adverse events. Okay? So, in AE dataset, subject is going to have 10 observations. Now, how do you know which adverse event first occurred?
AE onset.
Very good. We are going to sort the data by subject, within the subject ASTDTC. Okay. Now tell me, now how we are going to write? How we are going to write? Now, how do you know that which observation has got a, which adverse event is what you call first one or not? How do you can tell that one? How we can tell that one? Very good. 101, he has got headache, and this occurred on 21st of January. 101 has got, say, for example, nausea, it occurred on 10th of February. Okay, 101 has got rashes, it occurred on 13th of March. Okay, and 101 again he has got fever. Okay, and then fever occurred on 20th of February. 101 has got, say, for example, cold, and occurred on 10th of March. Do you know which one, when that occurred, first one? And this is the first one. Now I want to have, a variable called AOCCFL, the first occurrence of any adverse event. For this observation, I want to have Y. Now, how we can have Y for this one? First of all, I'm going to sort the data within the subject by ASTDTC, so that the earliest adverse event is going to come first, and the latest adverse event is going to last. Then now by writing, if first dot subject is equal to 1, AOCCFL is equal to Y. Understand this one? Clear, everybody? Now, the next variable that we are going to have, yes?
If first dot AESTDTC.
No, first dot subject ID.
Subject ID, okay. But sir, subject ID is the subject ki n number of adverse events untai kada sir.
So I want to have first adverse event in the study. First occurrence of any adverse event.
Okay. అంటే అప్పుడు స్టార్ట్ డేట్ మెన్షన్ చేయాల్సిన అవసరం ఉండదా సార్?
No, I'm sorting based on the start date, no.
Okay.
While I'm sorting, I will sort within the subject by start date. So that means
Yes,
when I'm sorting by subject ID by ASTDTC.
ASTDTC. Yes, sir. I missed that ASTDTC.
Okay. And now, the second variable that we are going to have is AOCCSFL. First occurrence of SOC flag. Sorry. A subject has got a headache on 21st of April. The same subject has got, say, for example, on 101, he has got, 101 has got migraine. He got on 20th of March. Again, sorry, excuse me. 101 has got again headache on 10th of April. Again, 101 has got head pain on 10th of May. Now, can you tell me this headache, this migraine, this headache observation, and this head pain, all these four comes under which system organ class?
Nervous
CNS, right? Central nervous system. Okay. Now, I have nausea, vomitings, and a few other. All these nausea, vomitings comes under which body system organ class? Gastrointestinal. Now, I want to create a flag in a body system organ class. when that first adverse event occurred for the first time. Now, this headache comes under CNS. Okay. Now, this migraine comes under CNS now. And this, again, head pain comes under CNS now. And if I have any, so this also comes under CNS. Now, in the central nervous system, when that first adverse event occurred, this one, right? Headache. In CNS, for this observation, we are going to have Y. Now, nausea comes under gastrointestinal GI, and vomitings comes under GI. And if I have any constipation or like stomach upset, that is also comes under what? GI. In the GI body system organ class, when that first adverse event occurred, this one, right? This is going to be Y at the body system organ class. So that means what I want you to know now, within each body system, when that first adverse event occurred for the first time. Now tell me, if you want to do in that way, what is the SAS program that you are going to suggest to me? Now, how I need to sort the data now?
Subject ID, AESTDT, and then SOC.
We need to sort the data by subject. Within that SOC, start date. Now, all the central nervous come at one place. All the gastrointestinal will come at one place. Now, within the central nervous, which one will come first? The earliest one.
Earliest one. Yeah.
By writing a what condition statement I can write now, for this one I can get Y, and for this one I will get Y. If first dot AE body CC is equal to 1, then AOCC SFL is equal to Y. Understand this one? And the next value that we are going to have is AOCCPFL. First occurrence of preferred term flag. You can have a multiple terms, but some terms is going to come under one decode, isn't it? I have, pondering headache. I have a headache. Both will come under which preferred term again? Both comes under headache only. But we have two observations. Now, what I want to have preferred term level flag. How to create a preferred term flag now? We need to sort the data. Subject. Within the subject body sys. Within the body sys preferred term. And within the preferred term? AESTDT. And then by writing what first dot variable I can write now? If first dot decode is equal to 1, because we have a decode, preferred term as a decode. If first dot AE decode is equal to 1, then AOCCPFL is equal to
Y.
Everybody could be able to follow this one? Because in the interview, they will ask you, what are the variables that you derived in ADAE dataset? Yes, all these variables are deriving now. AOCCFL, AOCCSFL, AOCCPFL. Now, the next one that we are going to have, AOCCIFL. First maximum severity occurrence. What is the first maximum severity that occurred? Do you know where we can find the severity information? In which way we can find the severity information?
Grade.
AE severe. Now, again take this example. First time when the subject has got a headache, it was mild. Again, this nausea is also mild. But when he got rashes, he got very severe rashes. Now this is, say, for example, moderate rashes. When he got the migraine problem on 20th of March, it was very severe. Okay. Now tell me again, I got sometimes this is in a mild, and say for example, and here he got severe again one more time, and this was the fever was very, moderate fever like this one. And this cold is mild, and this head pain is moderate. But can you tell me in this data set when he's got that severe problem, any adverse event? Highest severity, 20th of March, migraine. For this one, I want to have Y, AOCC-IFL, maximum severity for any adverse event. How we are going to sort the data now? In future, we are going to create a variable called A severity N. If A severity is equal to mild, I'm going to have 1. If it is a moderate, I'm going to have 2. If it is severe, I'm going to have a 3. Now tell me, this is called A severity numerical. By sorting how, by which variables you can get the maximum severity first?
Subject ID, AESE, AE severity numerical, and then
Okay.
STDTC.
Very good. And then by writing A severity, first dot subject is equal to 1, I can get highest severity first. So for that, I'm going to have AOCC IFL is equal to Y. But if I say A severity N in ascending order, what you will get? Mild one will get first. But highest severity, which one? 3, right? How we are going to do that one now?
Descending.
We should sort it either descending, or you can go with but descending is the best option. Understand this one. Then the next one that we are going to have is AOCC SIFL. What does it mean? In the system organ class, the maximum severity, the first maximum severity. And then we are going to have AOCC PIFL, maximum severity at a preferred term level. Understand this one? So these are the variables that you are going to derive, very, very important. AOCCFL, AOCC SFL, AOCC PFL, AOCC IFL, AOCC SIFL, AOCC PIFL. Understand this one? And then we are going to have the next variables. Now, these are the variables. AE severity. According to the AE severity, from where you can get this AE severity? Directly you can copy from AE domain. AE seriousness, AE severity numerical, and I have written. And then severity group wide. The sponsor will tell you if it is a mild and moderate, keep it in one group, severe 2. Group numerical, A relation N. If it is not related 1, unlikely related 2, possibly related 3, related 4, unknown 5, not applicable 6. You will tell some numerical data. Based on that, we are going to create relation numerical. A relation group Y, and group Y numerical, and then we are going to create toxicity grade. We are going to have an ICD classification based on the International Cancer Institute. Based on the Cancer Institute classification, we are going to have toxicity grade, and I will tell you later how to do that one. Based on that, we are going to create toxicity grades. Remember, in AE, when you will have a toxicity grade variable value, I told you that time. If you have AE severity missing, then I told you, you will have value in toxicity grade. Severity ఏముండాలని values?
Mild,
moderate, severe.
Moderate and severe.
But I told you, in some oncological studies, you will have missing value in AE severity. In that scenario, in which way we are going to have value? In toxicity. Okay? And then we are going toxicity grade numerical, toxicity grade Y, group numerical, and AE action. This is also directly from AE dataset. These are the variables that we are going to have in ADAE dataset. Clear, everybody? I'm going to upload this PPT now into the WhatsApp group. Please go to that PPT because it is very, very important. Read all the variables. In tomorrow's class, we'll write the code. Clear, everybody?
Yes, sir.
Yes, sir.
Yes, sir.
Okay, then. See you in tomorrow's class.
see you, sir.
See you. you.